Hi everybody, we made it. Last project of the semester, and I did my project on the current policy that Montana has on fighting its opioid epidemic. So before I get started, I just kind of wanted to let you guys see how this has affected Montana. Currently, 44% of all drug overdose deaths are attributed to opioid use in Montana. And for every 100 people in Montana, there are approximately 70 to 80 opioid prescriptions. More than 700 Montanans have died from opioid overdose since the year 2000. And probably to me anyway, the most important is as of 2015, over 15% of high schoolers have reported taking prescription medication without having a prescription. So how did we get to where we are currently in Montana and in the nation as far as this epidemic we're seeing with opioid abuse? What I found was that there were some studies done on chronic pain management with people who had terminal cancer in the 1980s, and it basically showed that people with terminal cancer were not having their pain adequately managed. And there's a big push that kind of promoted pain as the fifth vital sign. So it really forced providers to focus a lot on pain and use it as a measurement on how well they were managing their patient's health. And at the same time, a pharmaceutical called Purdue Pharma developed long-acting oxycodone and basically marketed it saying that it was not addictive because it was long-acting, and this turned out to be false. And there's been a ton of court cases and lawsuits regarding Purdue Pharma because they basically covered up that it was in fact addictive, and they didn't let anybody know. This is just a brief review of how the policy in Montana was adopted and implemented. In the beginning of 2016, Montana Injury Prevention Program applied for and received a 3-year grant from the CDC directly to be used for addressing the opioid epidemic in Montana. And through this, the MIPP created a coalition of state agencies entitled the Montana Opioid Strategic Planning Task Force, and it includes a number of stakeholders from law enforcement to educators to different people with different positions in the community, and it includes healthcare providers, pharmacists, a whole onslaught of different people throughout the state of Montana that got together, and eventually by the year 2017 or August of 2017, they had developed a policy and a statewide plan to address the opioid epidemic in Montana, and then it was adopted and implemented in November of 2017, and it will be reviewed in the year 2019. So in developing its policy, basically the coalition found that there were 6 key focus areas that should be included in its policy, and these included partnerships, prevention or education, enforcement, monitoring, treatment, and then family and community resources. And out of these 6, I found that, and we'll see coming up here, that there were 3 that most states are implementing, and there are 3 that really seem to yield the most success. The question that I had that kind of drove my research was, were any of the focus areas that Montana has in its policy being used in other states? And if they were, which focus areas are most frequently used and most successful? I used a qualitative analysis for my method in my research just because Montana has a very well laid out policy, so it made it easy to compare it to other states' policies. Montana's policy is not due for review until 2019, so any data regarding the policy would only be a year old and not very reliable, and there's really not that much data out there anyway. I was able to review policies and methods in other states, and these policies and methods encompass both rural and urban populations. What I found in my research was that there were 3 of the different focus areas that showed up most frequently and were most successful throughout the states that I reviewed. And those 3 focus areas were prevention and education, especially as it pertains to healthcare providers and pharmacists, monitoring and treatment. And the monitoring really is focused on monitoring the number of pills and prescriptions that are circulating throughout the state of Montana. The prevention and education portion that I found really focused on the providers and pharmacists and the new prescribing recommendations from the CDC, and just making sure that the providers and pharmacists work together and are aware of what the new prescription recommendations are. The most success found in the monitoring focus area really zoned in on electronic monitoring of the number of pills there are in circulation, the prescriptions that different patients have. It really allowed for enhanced communication between providers and pharmacists to make sure that patients were trying to get multiple prescriptions filled or try to get multiple prescriptions from different healthcare providers. And currently in Montana, we have the Montana Prescription Drug Registry, which acts to monitor the pill circulation in Montana. The last focus area that I saw in my literature review coming up in the other states was just simply treatment, and more specifically medication-assisted treatment, so the use of things like methadone to treat those who are struggling with an opioid addiction. And this also included an increased access for rural communities by the use of telemedicine, and it also included companies dedicated to increasing healthcare availability in rural areas. So I'm not going to go through all the stats on this slide. You guys can kind of pause it and just read through them. I just wanted to point out really quick that Ohio and Oregon had some pretty substantive policies already in place and have seen some pretty significant success with these policies. So you guys can just kind of look at those and see how well they are doing with just the 3 focus areas that I had discussed. All in all, there is nothing indicating Montana would not see success in these 3 focus areas. I suspect, and this is just my own personal thoughts, that maybe there will be issues with treatment just because Montana is so big, and it may see some issues with trying to get telemedicine in rural communities, because the closest town to a town of 80 people may be only a town of 1,000 people, which may kind of prevent them from being able to do the telemedicine and getting some staff there or getting some of those rural companies there. But I guess we won't know really what the success will be in Montana until 2019. Thanks for listening, guys, and have a great summer.